Shoulder arthritis can happen in the elderly, although it's not very common in the local population. But if it does happen, it can cause pain and limited range of motion of the shoulder. This can affect activities of daily living, such as showering, changing of clothes, and self-care. In cases that don't respond to non-surgical means, such as physiotherapy or painkillers, surgery is advised. Surgery would be a form of a shoulder replacement, and this is similar to the knee replacement, in which we remove the diseased part of the bone and the cartilage and we replace it with metal. It is considered a major surgery, so an overnight stay in the hospital is advised for monitoring after the surgery. Operation usually takes around 2 hours. After the surgery, you may be required to wear an arm sling for about 1 month to help the shoulder heal. And physiotherapy will be started the day after surgery. You'll be expected to move your shoulder, but with a limited range of motion.